Hi everyone. I am just going to share my presentation with you. Okay, so my name is Liz Simpson and I am going to tell you a little bit about health psychology and in particular our MSc in health psychology that we have at Ulster. So I'm just going to start off my talk by talking a little bit about what health psychology is. So health psychology really is primarily concerned with the psychological and emotional aspects associated with health and illness. And it's really the application of psychological theory, research methods to the promotion and maintenance of health, the prevention and treatment of disease, and the analysis and the improvement of our healthcare systems. So health psychologists really can work in a range of different locations and across a different range of jobs within the health service. So what do they tend to do? Well, some will work in clinical settings. So they might work in hospitals. They might be working in rehabilitation with patients who are recovering from a heart attack or someone who's maybe developed diabetes, and they would help and support them with things like behaviour change, maybe trying to adopt a healthier diet or trying to increase their levels of physical activity. Some will also work in GP practices, carrying out sort of a similar role, or they might work alongside other health professionals such as dentists, nurses, and nutritionists. So what sort of work will they do? Well, they might do behaviour change interventions. So again, as I've already said, maybe trying to increase physical activity or getting people to change their opinions or attitudes towards a healthy diet. They might work with communication and trying to come up with more effective communication systems within the healthcare setting. They might train junior doctors in how to communicate more effectively with their patients. They might deal with the psychological impact of a particular, maybe severe diagnosis of illness, maybe a terminal illness. And very often they will work with people with chronic conditions. So again, a whole range of different clinical settings that they might work in. Some health psychologists will work in research, maybe working on grants and projects. Some may work within units looking at medical statistics, and they will write reports around statistics for maybe doctors, for the Public Health Agency, a variety of different organisations. They could feed into that. Research projects might include things like, how do people adapt to chronic illness, or what factors will influence healthy eating. A lot of health psychologists will work as academics, so they will be lecturers, research associates, supervising maybe a range of different research projects. They might work within the area of public health. And again, very much the emphasis here would be on behaviour change, trying to promote healthier behaviours and trying to sort of minimise or decrease those unhealthy health-related behaviours. They may well work in health promotion. They could actively be involved in designing and running health promotion campaigns, and also in health needs assessment, which is really key for telling us where health promotion can be more effective. So how can you become a health psychologist in the UK? Well, you start off, you need an undergraduate degree in psychology that is accredited to the BPS or the British Psychological Society. We will also look at degrees that have been accredited by the Psychological Society of Ireland as well. If you are a student who's done a degree somewhere else across Europe or globally, then we will look at that in relation to its equivalents, and very often the BPS will look at degrees from other countries for equivalence levels. So there's different ways that you can get onto the degree programme, but your main subject area must be in psychology. That will lead on to stage 1 training in health psychology. Health psychology is similar to forensic and sport and exercise psychology in that there's 2 stages for postgraduate qualification. Stage 1 is the MSc, and then stage 2 is a professional doctorate in health psychology. So in order to get onto the professional doctorate, you have to do a BPS accredited MSc in health psychology, which our degree is at Ulster. And then stage 2 in professional training, the degrees that are provided by a range of universities across the UK would be BPS accredited and HCPC, or Healthcare Professions Council, approved as well. So just to look at our MSc in Health Psychology at Ulster, this is a relatively new programme. It has been redesigned and has been running since January of this year. We have been teaching health psychology online at Ulster for the last, over 12 years. So we have lots of experience in teaching online. As I've said, this is a new programme, so it's being presented in a slightly different way in collaboration with an external partner. It's delivered entirely online through Blackboard Learn. You study it part-time, so there's no full-time option on this programme, and it's over 24 calendar months. What's slightly different about it is normal MSc programmes will start in September and end in September, but we actually have a sort of like a rolling intake. So we have 5 intakes across the year, January, March, May, September and November. So it's quite flexible. So you can kind of begin the programme at different times and with different modules. You can step on and off modules as well. There's a lot of flexibility around studying within this particular programme. So we have 2 carousels, and basically the carousel represents a collection of modules. So carousel 1 is made up of biobehavioural mechanisms underlying health, social, cultural and family perspectives in health psychology, and methods and issues in research and practice. So if you were starting, this degree, say in January, the first module would be biobehavioural mechanisms underlying health. That would start in January. The next module, social, cultural and family perspectives, would start in March. And then the longer module, methods and research and issues in research and practice, would begin in May, and that would run until September. So in September, then the biobehavioural mechanisms would begin again. So they kind of run on a loop, just to sort of give you an idea of how the modules sort of operate. Once you have completed carousel 1, then you would move on to carousel 2. And again, they run the same way. They start off with context and perspectives in health psychology, moving on to individual perspectives in health psychology, and then that carousel is the last module is models and applications. So they kind of run on a loop. So you might come onto the programme and start off with social, cultural and family perspectives, then move on to the research methods module, and then go back and complete the biobehavioural mechanisms. It really just depends on when you start. So there's a wee bit of flexibility around when you start. You can step on and off the carousel as well. If you decide you do one module and you decide you want to have a break for the next teaching period, you can do that. And then you have to complete carousel 1 and carousel 2 in order to be able to progress to the research project and dissertation. We have a lot of innovative assessments. They're sort of real world assessments. This degree is really designed to get you ready for stage 2 training. So we do a mini systematic review, and if you go on to do stage 2, a systematic review is part of the research competency for stage 2. You might be asked to design a poster presentation to convey a health message to a particular target group. We do a health promotion campaign. There's online focus groups where you take part in a qualitative research project. There is a consultation report where you're responding to a consultation that was put out by the BPS themselves, and you have to write a response to that. So that might be something along the lines of, responding to a piece of information that has come out and they're wanting a psychological perspective on it. So it might be to do with, the smoking ban. How would you kind of add to that and maybe change how the smoking ban has been portrayed over the last few years to actually increase the number of people who give up smoking. There's also discussion forums, so there's lots of opportunities to interact and talk to your fellow students. And there's also group work. So again, getting to know your cohort a little bit better, because we know that studying online can be sort of a lonely experience for some people. So creating those opportunities to create a community of practice within the MSc is really important for students. We follow the curriculum that's set out by the Division of Health Psychology's Training Committee. This was updated in 2019, and all accredited programmes across the UK will cover this curriculum. So within our research methods, We will have qualitative and quantitative research methods. You know, we look at the context of health psychology and where it fits into medicine, how it fits in with other areas in psychology, such as clinical psychology. We very much focus on the physiology and psychosomatic disease processes. So it's really on physical health conditions that this degree is sort of focused in and around. We try to create an awareness and an understanding in our students of client groups and who the key stakeholders are for health and well-being. You know, we very much focus on those health-related behaviours such as smoking, physical activity, engaging in a healthy diet, and the attitudes and beliefs that sort of surround those behaviours, because it's really important to have an understanding of those if we're trying to kind of change behaviour. We also look at psychological interventions that apply to health. So we look at things like CBT, motivational interviewing. We also look at biofeedback in relation to how those can be used to kind of improve our health, our physical health conditions. We look at healthcare and the professional setting, and we look at how we as a profession have to behave sort of ethically and professionally within those different settings, and how we can contribute to those particular settings. We look at measurement issues within health psychology, and we look at how, you know, how it develops as a profession and how we can develop students on their professional journey and from an ethical perspective. We do an empirical research project. So on this degree, you are expected to go through an ethics process. So you've got to collect your own data on human participants. So we will take you through that process for your dissertation project from start to finish, starting off with the ethical application, going right through, you know, going out to different groups and organisations, collecting your data, analysing it and writing it up as a report. We also strongly encourage our dissertation students to publish their research as well. I think it's worth mentioning that just before I go on. So what are the entry requirements for our MSc in health psychology? Well, as I've already kind of hinted, we would expect a student who's applying for this programme to have an accredited undergraduate degree in psychology. To normally have, what I mean by an equivalent would be, you know, a BPS or a PSI accredited undergraduate degree, or if you're coming from outside the UK and Ireland, we would expect a student to have a sort of an equivalent degree within their own country. We normally will only take students who achieve at least a 2-1 classification or above. If you're coming from a different discipline, you know, sometimes people will decide that they want to do, you know, they want to change their career and they decide they want to become a psychologist. They can do a BPS accredited MSc psychology conversion programme. So again, we will take students that have successfully completed those master's programmes, but they must have a merit classification or above to be considered for this degree. We also look for eligibility for graduate basis for chartership with the British Psychological Society or with the Psychological Society for Ireland. If you have done an accredited undergraduate degree, you will automatically have eligibility for GBC. And then international students can apply for GBC directly from the British Psychological Society. They can apply for student membership of the society and then also eligibility for GBC. We also expect an English language qualification as well from overseas students, CELTS level 6 at least. The fees this year for coming onto the programme are slightly different for home students. So if you're living within the UK or within the EU, it's somewhere in the region of just under £9,000 at the minute. Overseas students will pay slightly more and it'll be just around 16,000 to undertake this programme. Our students really come from all different parts of the world. We usually have a few students from across Europe. And we have in previous years had students from Japan, the US, Canada, Australia, you know, Southern Africa. It really just depends. We have usually quite a good cohort of students, and it's really interesting to have that variety because you can actually get an insight and an understanding of the health systems in different countries and also beliefs and attitudes around health and well-being from different cultures. So a really fantastic experience for students on this programme. If you want further information about the programme, if you've got some queries, you know, and you just want some additional help and information, you can contact me directly, and I've put up my contact details here on this slide. You can have a little look at our course video, and I would also strongly recommend that, you know, even it doesn't matter if it's health psychology or clinical or forensic, the BPS have a fantastic career pages on their website, and I would really strongly recommend that you have a wee look at that as well, and explore some, you know, the areas and the different sort of divisions of psychology that are available there. Okay, and then this on this slide here is just some praise that we've had for our health psychology programs at Ulster over the last few years. You can see there a few quotes from some of our past students who've really found the degree really helpful to sort of progress their own careers, and they've got a lot from it. And quite a few of our students in the past will stay on and do PhDs with us as well. And I've had a couple of students who've done their PhDs alongside their stage 2 training in health psychology too. So there are opportunities there as well. And you know that we've got some fantastic feedback from our previous accreditation visits from the BPS as well. So just thank you for listening. You know, and as I've said, any questions that are specific to me, if anybody wants to email me directly, I'd be more than happy to answer any queries that you might have. So I'm just going to stop the recording now.